Hi, this is Dr. Dave Heber. Today I want to talk to you about body fat. We're starting a new series about body fat. What makes it go to particular places in your body? What does it do? And how do you get to lose it? And why does it grow back? And how? So let's take a look. Well, first of all, why is there body fat? Well, the first reason is for storing calories for later use. You gain fat by eating more and exercising less, which is the real problem in the obesity epidemic. But body fat cells have other functions beyond storing fat, including heat storage and hormone secretion, which can stimulate or inhibit inflammation. Lower body fat can actually be good for you. It releases adiponectin, which is anti-inflammatory and controlled by female estrogen levels. So women get both upper and lower body fat. Men only get upper body fat. So here you see men with upper body fat, women with lower body fat and upper body fat. So everyone has fat, but you need to get to your personal best shape, and that's more than percent fat. So here we have women with 11% fat, 15%, and 18% fat. Now here are two women who both have 15% fat, but their shape is very different, and that's because the amount of muscle is different. So there's fat on the outside called subcutaneous fat that you can pinch, but the really important fat is the fat that's on the inside of your body. You know, we have an organ of starvation, which is intra-abdominal fat. And intra-abdominal fat is the first place you gain fat, and it's the first place you lose fat, not only inside your stomach, but also in the neck and up here in the upper body. So let's take a look at how you lose fat. Well, in order to lose fat, you need to burn more calories than your body needs, and then it gets the energy it needs from the body fat. And the fat cells release their fat as two things, glycerol and fatty acids. And these are then burned by the mitochondria in your cells, and carbon dioxide gas goes out through your lungs, and water goes out in the urine, and some energy is made called ATP to make up for the calories cut from the food or burned with exercise. Now, a deficit of 500 calories per day or 3,500 calories per week will result in 1 pound of fat loss. And the first place you lose that fat is in the abdomen, and you can see here over a period of weeks you can actually change your abdominal fat stores. And during growth, the fat cells multiply, and you have more fat cells. You can grow an infinite number of fat cells throughout your life. People with extra fat cells can regain the lost weight more easily. And so this is something that you want to watch out for by following balanced nutrition and a healthy, active lifestyle. So let's take a look at how human fat grows. Whenever you eat more calories than you burn, the glucose, that is from carbohydrate, triglycerides from fat, come into the fat cell, and they're stored as what's called triglycerides. And then as the fat cells grow, they need to grow their own blood supply. And they grow very quickly, and they start to develop these blood cells that form the blood supply for the fat. And you can see it here. So fat is more than just a bag of fat. It's actually a living organ in your body. It's part of the hormone secreting system called the endocrine system in the body. And the blood vessels carry the products of the fat cells out to the general body, whether it's for metabolism or for inflammation or anti-inflammation. Now let's take a look at how different body fat stores actually work. Let's look at upper versus lower body fat. So the upper body fat is called android. Android means male-like. Gynoid means female-like. So the lower body fat, represented by this pair, is the female fat. The male fat is the apple or upper body fat. Now, it turns out that women can have a pear-shaped or apple-shaped configuration, whereas men only get the apple-shaped with the upper body fat. So some women have upper and lower body fat. Some women just have more upper body fat. And what this fat is deposited is to save calories needed for breastfeeding and for growth during pregnancy, and that's why it's called female fat in the lower body. It's promoted by estrogen. It's harder to lose than the upper body fat. The upper body fat always goes first, but lower body fat can sometimes develop a dimpling shown here, and that's called cellulite, and this is due to connective tissue going down deep through the fat to the lower part of the skin, and this is something very common in women as they age. The answer to that is more exercise, cutting calories, and eating the right amount of protein to fill fill up that compartment in the legs. Now let's take a look at fat in the abdomen. I've been talking about internal abdominal fat. This is what it looks like on a cross section, and as you lose the fat, this goes away. Most of this is around the intestines, and the intestines is where you have 70% of the immune system, so that's where inflammation occurs. And remember, the fat cell is more than just a bag of fat. It secretes a lot of pro-inflammatory hormones, as well as in the lower body anti-inflammatory hormones, and this is how there's an association with increased interabdominal fat in about 130 different conditions associated with obesity. In a study of men and women walking around the city of London, Dr. Jimmy Bell at Westminster University showed that 45% of women and 60% of men had increased intra-abdominal fat, even at a normal weight and height, or body mass index. So you have to think about the internal abdominal fat as something that you get rid of with a combination of diet and exercise. Diet alone will not do it. And then let's look at fat under the skin. This is fat under the skin is fat you can pinch. It is actually good for you. It's a subcutaneous fat store where you can put extra calories. People who don't have a lot of subcutaneous fat are those people who have the fat move into the internal abdominal fat area first. So having subcutaneous fat's not a bad thing. It gives women their nice round edges. It does change over time and as your body shape changes, but subcutaneous fat is actually not bad for you. Now let's talk about a special kind of fat called brown fat. Now, brown fat, we have very little of it in our body. Instead of storing calories, it actually creates heat. And what you can see here, here's some human with an infrared camera in normal temperature, normal room temperature. And now, if they have cold exposure, we put them in a refrigerator, all of a sudden, this brown fat here that's around the upper back and around the collarbone starts to produce more heat. So brown fat releases energy in order to keep the body warm in colder temperatures. Exposure to cold increases the levels of brown fat. Now, babies are born with brown fat along the upper back and shoulders to keep them warm after birth, but brown fat is present in very small amounts in adults by comparison to white fat. Now, a very interesting piece of research showed that skeletal muscle releases a hormone called irisin. And what irisin does is it actually takes a precursor cell of fat, and instead of going to a white fat cell, it goes to what's called a brown fat cell with all of these little energy factories called mitochondria, and these can subsequently even develop into muscle. On the other hand, the progenitor cell can go to a white fat over here just to store fat. So the difference between these two, this one stores fat, this one burns fat for heat. So if you want to get to your best personal body shape, you want to burn your fat optimally, and you want to do that through a combination of diet, balanced nutrition, and exercise. Let's take a look at how exercise would work. So this new form of exercise I've been talking about called high-intensity interval training is shown right here. Whatever you're doing in terms of muscle building, you do those exercises, and then every 45-minute session, you include 2 or 3 sessions of high-intensity interval training shown here. For a few minutes, for 30 minutes to 2 minutes, whatever you can do, you go up to about 90% of your maximum heart rate, then you rest for an equal period of time, and then you do it again, and you repeat this 5-6 times, and what that does, it burns 15 to 20% more energy than if you were to constantly exercise at a continuous rate. So as we talk about all of your body fat, you are in charge of shaping your best personal shape, burning your fat through a combination of eating the right amount of protein, exercising every day, combining both resistance exercise to fill up those compartments and high-intensity interval training to burn fat calories. This is Dr. Dave Heber. We'll see you next time.